Hello, hello, hello. I am too excited. I'm telling you, I'm too excited. So let me get myself together because I'm normally this dolled up at 9 o'clock. The only reason why is because I get to talk about something I'm super passionate about. So, question. Hmm. Do you know how to help a mom who might be experiencing some psychotic behaviors after she delivered a baby? Would you even know what that looked like? Probably not. Some people don't. And so that's why I'm here. I'm here to talk about postpartum psychosis and all the special services that are available here in the state of Georgia as it relates to emergency, crisis, and resources. So let's get started. I'm ready to jump in. Let me tell you. So my name is Tiffany Conyers. I'm a licensed clinical social worker. I'm licensed in the state of Georgia and South Carolina, and I get to practice clinical social work or psychotherapy with moms, new again moms, as well as their families. I'm all about maternal wellness, and I get the honor and the privilege to talk to you all tonight, about postpartum psychosis. What is it? What are the symptoms? What does it look like? How prevalent is it? Would you even know what it looked like if you saw it? So I'm going to talk to you about that. And of course, if you do see it, if it shows up with one of your family members, loved ones, or even yourself, you may start to feel like, you know what, something's going on. I may need some additional help and services. I'm going to talk to you tonight about what services are available for those that are in a crisis or a specific emergency related to behavioral health. So let's jump right in. So what is postpartum psychosis? Well, I want to start off by saying that it's super rare, right? So that means only 1 in 2 out of 1,000 deliveries will there be an instance of postpartum psychosis. But what you probably hear about in the news is that a mom had a nervous breakdown and ended up killing her babies and killing herself, or killing her babies believing that God told her to do it. And that may be what you may read in the news or hear in the news stations or whatever. You may get that, but it doesn't always mean that a mom who's experiencing psychosis after she delivered her baby is going to hurt herself or hurt someone else. And so let's talk about what those symptoms are. So I do have some notes to keep me on track because, as much as I love to talk, I could go off subject. So if you see me reading, that's what I'm doing. I'm just trying to keep up with the notes. So like I said, it's rare. It's super rare. You're going to not see it as often, but when you see it, you're normally going to probably say something's a little off. Something's going on with mom. She just had her baby, and all of a sudden she doesn't want to touch her baby anymore. Or she believes God is speaking through the baby to her. And if that is the case, we really want you to know what to do and have access to the services available to support this mom in need. So again, it's a medical emergency, and it's not the same as postpartum depression. So a lot of people may hear like, oh, she's just dealing with some postpartum. And postpartum has been kind of coined the illness of all those that have experienced a delivery recently. And that's so not the case, right? There's so many other diagnoses that could be there. And in the case of postpartum psychosis, it's completely treatable, and it looks like psychosis, looks like psychotic features. So what is that? That's hallucinations. And hallucination is simply something that comes from a false reality. So someone who sees something that isn't there, or they hear something that is not there, may even feel something that's like a tactile hallucination. They may smell something that's not there, that others may not be smelling or picking up. And it's connected to a delusion. So some moms who are experiencing psychosis, it shows up in a delusion, which is a false reality. It may not be exactly what's happening. It may be based on something specific, maybe a religion or religious belief, maybe a concept, but it's not the actual factual truth. And normally a mom who's experiencing this is probably not going to know that she's having a psychotic break. So it's going to take having loved ones around that can specifically support, know what's different, and be able to get the help there as soon as possible. So part of my work as a licensed clinical social worker, again, I'm Tiffany Conyers. For those who are just kind of jumping in, I am talking to you all about postpartum psychosis and the emergency services that are available here in the state of Georgia and throughout the nation. There are some services that you can access by phone and by text, and I'll go through those as well. But I get a chance to work here in the state of Georgia as it relates to maternal wellness and crisis intervention. And so I've seen so many instances where family members have called because a loved one was experiencing a crisis. And the crisis that I'm talking about includes suicidal ideation, someone who's considering or really heavily thinking about ending their life by suicide. And you know, September is Suicide Prevention Month, so we want to talk about that, and the services are available for those who are experiencing that. But also homicidal ideations or psychotic features. And remember, psychosis can be in the form of delusions that in a lot of ways can and cannot be harmful, but they're very real to the person who's experiencing them. So it's really hard to try to get them to not be delusional. That makes sense. Whenever I've gone on a crisis intervention for someone who called the number that we have access to here in Georgia, like I said, I'm gonna get into all of that. We've been able to intervene and support people as they were in their delusions, but we never tried to talk them out of their delusion. And that's probably what's gonna happen when you're experiencing a mom who's having a postpartum psychotic break. There's no talking them out of their delusion. There's no talking them out of it. If they're having an intrusive thought that they need to harm their baby or there's something wrong with their baby, and if they experience guilt because of it, like, oh my gosh, I just saw myself, I had an image of myself drowning my baby, and that scared the mess out of me. If they're scared, that's not psychosis, okay? Psychosis shows up and that mom is not afraid of that thought, that she may not feel guilty because of that thought, that thought doesn't bring her distress or alarm in a way that it would a mom who may feel really bad that thought came in and out of her mind. So just to put that out there. So psychosis doesn't look like that. Again, the delusions or strange beliefs sometimes are really religious in nature, but not all the time. Like, for example, the baby is Jesus or a demon, or this mom is superhuman and has specific special powers or abilities that others don't. And so the delusion may seem very, very real in that way. And again, we're not talking these moms out of their delusions. That's not our role. Our role is to get help if we start seeing something abnormal with this mom. Again, those hallucinations. And then they also probably are starting to feel irritated. They're easily agitated. So a mom that's kind of the buttons can be easily pushed. You notice the mood swings are really, really short. You know, like I'm jumping to and fro from my irritation. They also may be very hyperactive. And what does that look like? We call it in social work mania, and that means that they're hyperverbal. They're talking a lot. They're talking fast. They won't sleep. They have a disturbance in their appetite. They're not eating. No need to eat. No need to sleep. Just super like agitated and kind of like all over the place, almost hypervigilant as well. And again, when a mom is experiencing that and they never had a history of psychosis, or had a history of these behaviors, it probably does put you in a position where, you know what, I don't know how to help. I can't convince her to get the help. This mom may be also experiencing difficulty communicating. So they may be extremely tangential, which means that they're stuck on a specific topic all the time, probably the delusion that they're experiencing. And when you try to get them to talk about anything else, they may have a hard time communicating with you. So just kind of keeping all of that in mind as we think about, well, what is postpartum psychosis? So let's just wrap it up again so you'll know. Postpartum psychosis looks like a psychotic break. It looks like someone who may be experiencing a delusion, a false reality, a strange belief about something as it relates to their baby or something else. But this didn't happen before they delivered. This happened after they delivered. So that's why it's called postpartum. This also may mean that this mom has issues communicating, has really, really extreme mood swings, highly agitated and irritable, and may even feel like they can't talk or don't want to talk, extremely paranoid. Some of the risk factors for postpartum psychosis, because you're like, well, what does that really look like? Can I get it? Can my sister get it? Is she pregnant? It's a possibility. Like I said, it's super rare and very treatable. Remember, 1 in 2 of every 1,000 deliveries shows up in the form of postpartum psychosis after delivery. So again, it's super rare, but once you catch it early enough, it's super treatable. Like, get them to the services that are available. And what we're trying to do, of course, is push awareness that this diagnosis is not a sign that I'm going to have to take medication forever and I'm going to be considered quote unquote crazy forever. That's not even the case. You're not crazy. You're just ill at this time. You can get well and you will with the proper intervention. And so the risk factors is just simply you having a baby. There have been some studies that shown that if a mom had experienced some type of trauma during childhood, some type of adverse childhood trauma, that could be a risk factor. If a mom has a previous history or diagnosis of bipolar disorder, that could increase chances of experiencing a postpartum psychotic break or being diagnosed with postpartum psychosis. But that's not always the case. That's not always the case for moms. So this can look like you. This could look like your sister. This can look like your auntie, your neighbor. It doesn't have a culture specific to it, doesn't have a specific skin color to it or age. This can be any of us. And so being aware of what it can look like can make you more equipped to help support a mom who wouldn't know that she even needed the help because of the delusions being so strong, the false reality or that strange beliefs being so real to her. So how do you get help? Well, you definitely would like to reach out to the doctor right away. So most likely if this is a postpartum psychosis, then this mom has just recently had a baby and probably has some appointments already lined up. If anything, if you're starting to notice something different, then you probably want to get in touch with the mother's doctor. That may not always be the quickest way because some doctors have set appointments. They don't really have an emergency or crisis line. There may not be that ability. So what you want to do is, if you're in the state of Georgia, you can call this crisis line. It is 1-800-715-4225. And at that number, you'll get in touch, or you actually get access to a licensed clinician, someone who is licensed by the state to be able to handle specific crisis calls. So if you are experiencing a crisis, anybody, whether it's you're suicidal, homicidal, or a loved one of yours is experiencing those, if your loved one is having a psychotic break, experiencing some hallucinations, you can call that number for them. And they will determine whether a mobile crisis team can be sent to you. What? What did you just say, Tiffany? I just said that if you call that 1-800 number, 1-800-715-4225 here in the state of Georgia, anywhere in the state of Georgia, you can have access to a mobile crisis team sent to you. Now, let me tell you why that's important. So part of my work as a licensed clinical social worker has been being a part of a mobile crisis team. I did that for a little over 5 years, and I've had the privilege of working with some amazing clinicians and paraprofessionals. And what we did was 24/7. We went out to various crises in the parts of the counties that we were assigned. We had 60 minutes to get there. And when we arrived, we supported a family member, a loved one, a third-party caller, could be anybody, and the person that was experiencing the crisis. And we offered linkage and support in the form of whether they needed to go straight to the hospital right now, or if we could get them scheduled an appointment with a licensed therapist or someone else that can give them what they needed, because maybe they're safe enough to stay home for a night and get to someone the next day. But in most cases, like I said, we were able to get there, show up, and say, you know what, maybe this person does need to go to the hospital. Let's go ahead and facilitate that. So I want to tell you a story about a mom that we encountered. I was able to staff this with one of my teammates who had never really seen or heard of this before. They never heard of postpartum psychosis. So they called and said, Tiffany, I know you talk about this mama stuff, you specialize in like how you help mamas, right? It's like, yeah, what's going on? Well, we just got a call and I showed up because this husband says his wife is acting really strange and she just had a baby. Okay, cool. So what had happened is that a week after delivering, this mom was coming home and was not acknowledging that her baby was real. She had a very strong belief that this baby was a baby doll. And so much so that she was doing very abnormal and neglectful and harmful things to this baby, where she would kind of tap the baby really hard, not gentle. You think about a newborn. She wasn't gentle with the baby. She treated the baby like a baby doll, looked at her husband, said, who brought this baby doll here? I didn't ask for a baby doll. Whose is this baby? What's baby doll? So there was this strong belief that her child was a baby doll, and not a real baby. And so that alarmed the husband. And so he was able to convince her to get in the car. Let's go to the doctor. And they see the doctor. Doctor sends them home, and doctor sends them home with some medication. So the clinician that shows up from the mobile crisis team is like, I said, well, who called you all out? Well, it wasn't the husband. The ambulance called us to come out. Huh? The ambulance? Yeah. The ambulance, the husband came back. It's like, she's still acting strange. She's not bathing. She keeps referring to the baby as the baby doll. We won't let her hold her. We won't let her feed her because we're concerned about what she might do to the baby. So we call the ambulance because we didn't know what else to do. Ambulance and the paramedics show up and they're like, well, we can't force her to get in the ambulance. No matter what, in the state of Georgia, they cannot force anyone to get into their vehicles without their consent. That is why they require a mobile crisis team to show up and intervene, because there's a special document that a mobile crisis team can sign that says that, no, this person needs to go straight to the hospital, and they will authorize an involuntary transport. So either way, that's exactly what happened. Ambulance was like, we can't do anything, but we know who can. Dun, 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 dun. They called that 1-800 number. And they were able to get in touch with the crisis team. And so the team member that was assigned, she's like, yeah, right now she's hiding behind the door. I see her. She's still in her hospital gown. And it looks like she hasn't bathed. Now, if you've ever had a baby, or if you've seen somebody that's recently had a baby, normally after they've delivered, they're not still in their hospital gown at home. They probably have had a chance to do some hygiene. But this mom was soiled after delivering and was behind the door and was not talking, had a hard time communicating, was kind of babbling to the clinician that tried to engage. And what I said to her, I said, this sounds like postpartum psychosis. She just recently was discharged from the doctor again. Can you find out what's on that discharge paperwork? And so that clinician asked the husband, hey, did you get any paperwork from the doctor after your last visit when you thought like something's strange? Let me take her back to the doctor. And he said, yeah, here it is. And so he gave her consent to read through it. And lo and behold, there was a diagnosis of postpartum psychosis with a prescription of medication that she should have taken. Now, I'm not sure if that was communicated with the husband. The husband was very unaware of the diagnosis. He didn't know what to do. I'm so grateful that he said, you know what, I'm not going to just stand by and say, hey, come take your meds. Babe, come take your meds, and knowing good and well that this mom who's deep in her psychosis, deep in her delusion that her baby's a baby doll and that nothing's wrong, and who has a hard time communicating, really couldn't get her needs met, and she probably wouldn't have ever taken that medication. She wouldn't have trusted it. So with that said, we were able to get her straight to the hospital. I told her, I said, go ahead, make sure you sign that document, which we call as a 1013, and get this mom to an emergency room. And in that case, that mom was able to be service attended to, and they were able to hear directly from a clinician that says, let's rule out postpartum psychosis because this mom is a week after delivering her baby, and she is not bonding. She doesn't even believe the baby is real, and she has no history of mental illness, no history of psychotic behaviors. So in that case, it really helped to know what those features are and who to call. And so I just want to put that out there, that number is a great number to go ahead and save in your phone, 1-800-715-4225. And that's, again, a Georgia emergency crisis line. If you are in the position where you can support a family member, please know that it's available 24/7 and throughout the whole state. That means every county has an assigned mobile crisis team or mobile crisis unit assigned to it. And that meant a lot to me to be able to say, like, hey, that sounds like postpartum psychosis. Again, postpartum psychosis is super rare. Again, 1 in 2 of every 1,000 deliveries. Yeah, I get it. I'm going to keep saying until you get it in your head. Either way, you know that it is, but it's prevalent. It does show up. In cases like the Andrea Yates or the other moms that we've seen in the news that ended up hurting themselves or hurting their babies because of some delusions that they experienced after they delivered within the first year of delivering. It doesn't just show up right away sometimes. It could be something that shows up a little later. So just knowing exactly what it looks like, or at least knowing that, you know what, something's different. Something's going on with this mom. I really think I should call someone. And knowing who to call definitely will empower you to do something. I can only imagine what, in this case that I mentioned about the husband who called, who took her to the doctor, came home with some paperwork and a prescription, no plan, no awareness, no nothing. And then actually said, you know what? I can't let her do this. Like, she's not even responding to us. Let's call it 911. 911 knew what to do. Even if they didn't know what they were dealing with, they knew who to call, and being able to say, hey, this is what it is. That meant a lot. So with spreading the word, that means that you too can be a lifesaver. That's me with my cape. If you hadn't noticed, I was you too can save a life or save a mom and save a baby, and babies' families. Just be a proponent for families by just knowing who to call. So one of the things I just wanted to make sure I cover is that postpartum, the symptoms look like delusions, strange beliefs, sometimes religious in nature, like the baby's talking to me through God. God is talking to me through this baby, or this baby is a demon, or that this mom has superpowers or super abilities. That they see things or hear things or believe things are there that aren't, that you don't see. That's a telltale sign that this mom may be experiencing a delusion related to psychosis. Sometimes psychosis isn't always harmful. Like, just think about it. The mom is not saying, hey, my baby is telling me to hurt somebody. It's like, I believe my baby is the new coming of Jesus. That may not mean that I'm going to hurt myself for someone else, but it's still a delusion or behavior that may lead to some other bizarre and neglectful and harmful behaviors that with adequate treatment and quick response can be eliminated and, like I said, wiped out. We can treat it. We can take care of these mamas, these new families, by just having an awareness. And so just kind of keep that in mind, that those who are experiencing psychosis really need to know that there's help. Okay. I just want to make sure I make this point. Most women who experience postpartum psychosis do not harm themselves or anyone else. They just have some strange behaviors that wouldn't be their normal. Paranoia, suspiciousness. I remember just recalling the story, telling you about that mom that was in crisis, how she was behind the door, just unaware, like, I don't know who I can talk to, babbling, not able to communicate. That didn't mean that she was going to harm her baby, though she even wanted to. But remember, she wasn't well, and she didn't understand or know what was probably happening to her, because, again, her false belief, her strange belief was telling her that her baby was a baby doll and that her baby wasn't real. And so knowing the difference between postpartum psychosis and depression is super important. Remember, a mom may have fleeting thoughts of one not wanting to harm her baby or seeing herself harm her baby, and she feels super guilty about it. If she feels guilty, that's not psychosis, okay? If she sees and knows that that's a wrong thinking, a wrong belief, or that's a negative, that's not something that I would ever do or want to do, or just the idea makes me afraid, it gets me in horror that, oh my gosh, I don't even want to touch my baby because I'm so afraid that that would happen. Because again, she's aware that that's something wrong. A mom who's experienced psychosis would not see anything wrong with that. Does that make sense? I hope so. Cool. I'm going to drive this point into your brains. You can go to the ER. If you can get a mom to get to the ER, that's really cool. Sometimes you can't. And that's where a mobile crisis team or a unit coming in to support you can really, really, really help. Again, I've been so honored and privileged to be a part of a team that's kind of supported people in various crises. Those that have just recently delivered and those that are experiencing some real deep depression afterwards. So just know that whatever you do to support a family or a mother who recently had a baby is much appreciated. I also wanted to share that there's some other resources that you can utilize if you yourself or someone else is experiencing a behavioral health crisis. It may not be postpartum psychosis. Maybe you are considering and just heavily thinking about harming yourself or someone else. You can also text this stuff, like right now. You can text the crisis text line, which is you actually texting the word home to 741-741. Okay, so you type the word home in the actual message part, like I'm holding my phone, pretend, and then who you're sending it to is 741-741, and they will text you back. You get a response, and they'll take it from there. You can also call, again, the National Suicide Prevention Line, 1-800-273-TALK, which is 8255. And that's 1-800-273-TALK. And that's just being able to talk to someone who's equipped to talk to you about and just de-escalate or just process how you've been feeling, whether it's to harm yourself or someone else. These are some awesome resources that you have literally at your fingertips. Pretty much everybody has a cell phone and access to a cell phone. So this is the best way to get the support. And of course, if you yourself or someone you love is experiencing a mental health crisis, especially in the form of psychosis, like postpartum psychosis, call that 1-800 number, 1-800-715-4225 here in the state of Georgia, and you will get a licensed clinician on the phone. That's someone who is licensed to handle your crisis, to support you and walk you through what options you may have. They may be able to talk to that person. And again, like I said, if a mom is experiencing postpartum psychosis, they're probably not going to be equipped to handle a lot of questions because of their issues with communicating, be able to relate if they are deep in their delusion or their strange belief. I'll be even aware, cognizant that there is a need for help. Again, they're deep into their strange belief. I'm too tickled to have been able to talk to you about postpartum psychosis. I've actually spent some time talking to some other colleagues about it. I'm always spreading the word. Part of the work that I do is that I get to teach up and coming social workers, and even they know about postpartum psychosis. I don't limit this conversation to just you. So I had a student recently come up to me and say, Professor Conyers, listen, I was at my internship and I noticed a mom come in, and just the way she was acting, she just had a baby and she just didn't have a history of like bipolar or schizophrenia, like some things that they were trying to peg her as. And I told my field instructor, my field supervisor, I think this might be postpartum psychosis. And the way she described her field supervisor was like, oh, bless your heart. Look at you, just trying to diagnose stuff. That's so cute. Gave her the impression that, you know what, oh, grad student, just hold tight. And lo and behold, my student expressed to me that, you know what, I checked her chart and guess what? She was diagnosed with postpartum psychosis. And so I'm so grateful just to be able to spread the word about what this can look like. Again, a mom who's experiencing this is not going to be able to tell you, hey, listen, I'm psychotic right now, okay? They're probably going to be really deep in their delusion. So be mindful of that. Don't try to break them out of the delusion. Get the help, get the support. Again, 1 in 2 of every 1,000 deliveries, there's an instance of postpartum psychosis, and it's completely treatable and curable. These moms don't have to live with this forever. This is not a forever diagnosis. This is something that happened to them, but they're ill right now, and they can be supported and helped. And it will start with someone who's closest to them. So I'm so grateful to have spent this time with you. Thank you so much for taking the time out to just listen to this talk. I am elated for what's coming up next. In about 2 weeks, September 25th, we're having another Facebook Live episode. And this time it's going to be on panic and anxiety attacks and disorders. What are they? And their symptoms and how to treat them, because that's another one of those things that moms can get postpartum and beforehand, so let's talk about it. I am grateful to have spent this time with you. I want to just make sure that you know that we would love for you to tune in 2 weeks for that show, and that continue to share this information. So after you view it, post it, share it. Let's get the word out about postpartum psychosis. Not everyone has to suffer with these features and these issues. If we know what it is, we can call it out and kind of get the support as soon as possible. So again, thank you so much for watching. I want you to remember that you are not alone, that you are not to blame, and with help, you will be well. So thank you so much again. I'm Tiffany Conyers, and you have a great, great evening.